everybody, and welcome back to another Wellness Wednesday. I love being here at Advanced Integrative Medical 360. I get to hang out with my friend, Dr. Darren Dubiak, who owns the joint and has the degrees that go along with all the knowledge. But it was interesting, Darren, last time we were talking, you brought up this very special young lady, Destiny, and you opened the door into this conversation about gut health.
Correct.
Which is so important, and she really is a rock star. So I want to give it to you. Take it away, because this is important stuff.
No, I absolutely. And you heard, like, last time we did our video, it was our first video on really the gut now.
Sure.
So we talked a lot about different hormone functioning, the blood work. We really want to get into gut, and especially gut immune and how your gut and brain are connected. So we talked the last time, we brought up things like neurotransmitters, the vagus nerve, so all these things, and why that vagus nerve is so important again. And what it does is, there's something called your parasympathetic and sympathetic nervous system, and your vagus nerve is that huge component of your parasympathetic, meaning calming you down. And it controls so much, from appetite to hunger to mood. It does so much. So again, that's that long nerve, as I talked about, connecting your brain to your colon, to your gut. So I brought on this young lady today for a very special reason. Not only was she a patient of ours, she now is our patient coordinator. She's on concierge, and her story needs to be told. I wanted it to be told with you, and I wanted everyone to hear her success, what she still deals with, what AIM 360 did for her and what we still do for her, and now what she practices, what she preaches to others, and why she is not only our biggest advocate, but one of our best assets in the office.
Got it. Take it away. Let's go. I'm all in.
So
thank you for that introduction. I'm ready.
We'll take it. We'll take it. Actually, after this, you're not going to want to eat pumpkin. So we want to talk about gut immune health, okay? So you're going to see these words I have on here: genetics, microbiota, malabsorption, bowel habits, inflammation. So, all right. So last time we blew you away because, if you remember, I said over 70% of your immune system surrounds your gut, and you were like, huh?
Who knew?
So, and that's that big word again, GALT. It was that acronym, but it was gut-associated mucosal lymphoid tissue. So again, that's your body's first line of defense, more or less inside. Okay, now, what I want to talk about and how I want to direct, especially this video today, is we're going to go over these things, but then I want to go over how we fix them here, and exactly what we do. So we talk a lot about gut immune health, and we hear these words, oh, Dr. Dubiak, I hear I have good bacteria in my gut. You do. And not only do you have good bacteria in your gut, there's supposedly over 100 trillion types of bacteria, not types, excuse me, of amount of bacteria in your body.
What?
And that bacteria, right, it fights off certain things. Now, you got the superstars of the bacteria world. Like, you hear this thing, lactobacillus, you know? Oh, I eat yogurt. Yeah, but if you're telling me I should be on a dairy-free diet or stay away from, how do I get these things? So probiotics are a huge component of this, and we'll talk about that. But one of the neat things, and again, this is us just still researching and reading, a lot of your gut microbiota is actually genetics. And it's neat, they've been doing studies and studies and studies, and they've looked at gut tissue lining from 14,000 years ago of folks that they found, in Africa, and they saw that same commensal or good bacteria is in the gut of people still today. And it's so huge because we see that nothing's really changed except the time.
Okay.
Meaning stress, foods, travel. Remember, us now, we have the capability of traveling all 7 continents, right? We have the capability of doing those things. So a lot of how our gut microbiota has changed. Permeability, that's that big leaky gut word I said again, about those tight junctions. And I don't want to harp too much on this because I want to get to her today. And I really want to get to her when we get to our inflammatory responses. So we'll talk about that. We'll talk about bowel habits. Wendy, this young lady has been now with me for 2 years. If I hear one more person who can't poop every single day, I'd be a millionaire. It's amazing how constipated we are in this country.
Really?
Yes.
People literally just don't go to the bathroom.
What?
Yes. You know, according to AMA guidelines, American Medical Association, if you are not moving your bowels every 12 to 14 hours, you are regulated as being constipated.
Yes.
And I have people who don't go for days.
What?
Weeks. A week.
Days and weeks or weeks. Oh, but I thought that was normal. Oh, I go every other day, I hear. And it's funny. But is it funny? How does that really affect us?
Oh my gosh.
You know, so listen to me. If I don't go every day, it ruins my day. Ask my family. It changes me as a person. So it's amazing how bowel habits really change gut immune response.
Right.
Think about it.
Right.
It's just sitting there.
No.
So-
In, out. Let's go.
You got
Do
it.
what
You got
gotta
it.
do
You got it. You got it. You got it. Malabsorption issues. Again, different foods. And we're going to talk about celiacs in a little bit, and food sensitivities, and gluten, and dairy, and why our bodies can't all break these things down.
Makes sense.
But the biggest thing I want to go over today is inflammation of the gut. And we hear gut inflammation with Crohn's, colitis, and celiac patients. Now, this is where this young lady is going to shine, because I want her to tell you her story. Destiny, tell everyone what happened and what was your diagnosis and why you came to us a couple years ago.
So, where it began, I wasn't going to the bathroom. Those are things that you don't think about.
Right.
So you go to the ER and you say, what's going on? All they want to do, they want to scope, they want to go in, they want to cut, they want to do surgery. So I was scared to do that. I was very young. I was just graduating high school. They said, well, we can't find your appendix on your CT scan, so let's go in, let's try to remove it. First of all, I said, what does my appendix have to do with this? I'm not going to the bathroom, I have a bowel issue. So that was the first thing I was a little concerned about. You know, it seemed like they didn't know what was going on with me.
Sure.
So that's when I was in the hospital for about a week and a half, testing, scoping, this and that. They can't find anything wrong. So that would be enter Dr. Dubiak. All this time, we start doing GI map testing, what you were talking about, stool testing, finding out what is going on. One stool test later, what did we find? We found things like H. pylori, terrible bacteria that will make you sick. I had an overgrowth of strep. I had candida, which is yeast in my system. So those are things you really don't want in your system. They make you sick.
And Destiny, what diagnosis were you given, and what did you have gut-wise that was inflammatory in nature?
They did diagnose it as Crohn's disease. So I had that 2 to 3 centimeters of inflammation in my gut, and they didn't know where it was from. So it was diagnosed as Crohn's disease, that inflammatory response. Later did I learn it was the foods I was eating. It was all diet related. You know, I came in, I found all of these things wrong, and it was diet. You learn what foods you're allergic to, what things are bothering you, and you learn to get rid of those bacteria in your gut.
What were you eating that was wrong?
Oh, a whole list of things.
Oh, give her those
Yes.
examples, because
Yeah.
it's a fun list,
Yes,
trust me.
it is.
Because this isn't for
Yes.
everybody.
No.
This is what she knows about
Yes.
her, because she's
Our
singular,
testing.
as you would be too if you got this
Yes.
done.
Right, and
Yes.
she only knows that because she brought that word, it's called GI map. That's that stool
Right.
testing. It's
Yep.
on our website, and we'll talk about that in a little bit. But I want her, great question, what were you
What
eating?
were you eating?
A lot of people get upset when we say grains and dairy are the most common food sensitivities. What were the top 2 on my list? Grains, dairy, random things like tomatoes and spinach. I was poisoning myself every day and creating these inflammatory responses by foods I thought were healthy.
I was going to say, right? Who doesn't want
Right.
to sit down and have a salad and feel good about it until you
Yes.
can't poop for 48
Yes.
hours and you want to
Yes.
fall over?
Exactly,
Yep.
exactly. And we hear it so much, and you know, her being our
Absolutely.
patient coordinator and concierge, she hears it all the time.
All
But
day
I'm
long.
eating good.
Right.
I'm eating
She's like,
healthy.
aha.
But
Right.
You
there's
got
a
it.
but to that. You know, that we do those tests as well. We do food sensitivity testing. It all combines. You know, I even saw rashes on my skin. No dermatologist could figure that out. Food related. It all does tie back to the gut, your mood. You know, things like I struggled with anxiety and depression. The one thing they want to do is add a pill. And I said, wait a second, this doesn't seem like something that I'm struggling with. I said, there's something else going on. My gut. As soon as my gut was healed, guess what came back? My energy, my mood, that drive for life. You want to get out of bed, you want to enjoy life. All of that is tied to your gut.
And your skin looks gorgeous.
Yes, thank you. Thank you. It does all come around. Foods can be anti-aging. You don't always need a medication to take care of yourself. A lot of the time it's food, and it's how you take care of yourself. It is.
You know, I still look at her mystified. She was 18 years old. And by the way, what she's not telling you, obviously this main office is in Pittsburgh. She was driving from Ohio 3 days a week.
Yes.
What?
At 18 years old.
Yes.
Because at 18, the regular medical system wanted to cut something out and put her on a pill because she was depressed and anxious.
Yes.
The first time I went to Advanced Integrated Medical 360 to meet this one was the first person I met.
Yep.
She was sitting behind the counter, and I'm sitting waiting because he wanted to possibly sponsor my show. And I said, well, I can't have a sponsor if I don't know who he is and what he does. So I said, I'll come out and meet him. So I'm sitting waiting for him. He's wrapping up with a client, with a patient, and you're sitting behind the counter. So I start talking to her, and I said, so who are you? What are you all about? And she told me her story. She says, never before has someone listened to me.
Yes.
Listened to what I was saying. And she got tears in her eyes.
I
She's
did.
like, I'm hook, line, and sinker in this for it because it works and they care. And I walked into him and literally, I think I might have even given you a hug the first time we met.
You did.
Right? Like, I don't know you, but I was like, to hear what she said about you, and I said, I don't know if you know this, but the gal you have working at the front is your greatest sales advocate ever because she's a success story.
Ask
And that's
him,
exactly what happened that day, too.
I cried on his desk when I first came in. Nobody had ever told me it was my diet. Nobody.
You know, Wendy, it's again, I can't always use that word, empowering. It's so empowering.
It is.
You just empowered a young lady at 18 years of age that can now live a better, healthier life, not full of medications, because she doesn't want it. It's not that some medications don't work or work, it's she didn't want it.
Right, and it's not that all doctors don't know what they're doing. No. Doctors are fabulous, right? But when you're not getting the answers, I'm amazed that at 18 you were that proactive in your life. Because a lot of people at 80 aren't that proactive in their life.
And not only active, you're telling guys, a young lady, hey, don't eat pizza. I mean, that's like, you might as well just say, don't drive.
Right.
Yep.
You know,
A rude awakening.
Give me your phone, right? I mean, it's that severe. But when you feel that horribly, and she came to me and looked at us and said, just do, I will do whatever you tell me.
So what did you do? What's
Tell them.
So I drove out here. It's about an hour-and-a-half drive from where I live in Ohio. I came out for IVs. We started out 3 a week. I was assigned a nutrition coach. She helped me change my diet. I would track my foods, and she would call me and say, you need to stop eating that. This is not the protocol. And I said, okay, all right, I can't squeak by here. So all of these things, this is where it came into play. I started taking probiotics, like you were talking about. We have digestive enzymes you can take to clear that bacteria out of your system. So I quite literally had to detox. This was months. It does not happen fast. I went through months of dietary changes and fixing and restructuring the way that I ate because I learned that what I was doing was not healthy for me.
How long did it take you to feel better?
I would say a good year and a half. I did see within those first couple of months is when I really saw things turn around. That's where I saw it again in the brain. There wasn't results first here. This takes time. But my brain is where I saw it. I had energy. I felt like myself. I was able to think clearly about what exactly I was doing. And this word right here, what came back on my results? I was deficient in every single vitamin because I wasn't absorbing them from my gut.
Isn't that amazing? And that all came, excuse me for interrupting, Destiny, that malabsorption. So do you understand why IVs were so important? Especially how those IVs of what we do here. Listen, when we customize them to you, and it's not going through the gut. So doesn't it make sense now that this young lady's not only getting those vitamins and nutrients she needs to feel better, of course her skin, her hair, her nails are going to grow more. And when we talk about inflammation, Like we put Destiny on, the probiotics, different digestive enzymes. The digestive enzymes are pancreatic enzymes, things that help break down your foods for you. But another huge component we give is people with glutamine. Glutamine is definitely something that helps inflammation in the gut, zinc, things like that. And these are all in our products that we give our patients to heal. You know,
I get the IV now.
Yes, well,
Like,
think
I
about
get it.
it.
Because if
Exactly.
it's not working here,
It's
then
not
why
working
take more
anywhere.
through this, right?
And that's what you
You gotta
mentioned in
get
the
right
last
through.
video. I could take a vitamin D or I could take a B12 pill every day and it would do nothing for me. I absorb none of it.
and
You have to get
don't know
it.
until you listen to your
Yes.
body.
Yep.
You've got to listen to your body.
Yes.
You know, you know, I also want to interject because I know so many of my patients speak with this young lady and have never seen her. So I'm glad
Hello,
everyone who is
everyone.
watching.
Yes.
Say hi
This
to
is
Destiny
me.
now.
I am real.
And she's real.
Yes.
There you go. I mean, you have. It just, I don't know. I get emotional. Because I'm so. I get so passionate. But you had a young lady who did everything we said. Not only that, this young lady is now coaching 90% of my patients, talking to over 90% of my patients, and making sure they follow the plan.
Yeah, and I
Yes.
think a lot of people don't realize that you don't just get a blood test. You don't just get a binder that's got pages and pages of results. You don't just get a plan for the future. You have constant feedback and someone to talk to.
Yes.
And when you don't know, are you calling your doctor?
Yeah.
Or are you calling somebody like Destiny who's like, I'm here.
We are the detectives.
What do you need? I'm ready to help.
That is my job, to listen to you. Your symptoms have a cause. Symptoms do not come from nowhere. And that is something that I try to investigate in our patients. What is going on? Is it stress? Is it your food? What are you doing? There's something to cause that feeling that you have.
Right. Just giving people, one of the worst feelings, I think, is to not know, to go to a doctor and still not know,
Yeah.
to be bounced around from specialist to specialist and still not know,
Yeah.
and then
Yep.
to try to talk yourself out of it because you realize you have a choice. Either be miserable or just try to live with whatever you have. And it doesn't have to be like that.
Do you know what my choice was? I had two choices. I could take a medication for the rest of my life indefinitely, or I could not take a medication and you live the way that you typically hear about Crohn's disease. You're miserable, you're always in the bathroom, you hurt. That's not how it should be. There's something causing that.
You know, Wendy, before we leave today, we have to talk about this. And I'm going to end it with this.
Okay.
All right. This young lady, and I'm not even going to say the name of the product, but once every 8 to
knew you
12
were.
weeks, I have to say it. I have to, because I'm so infuriated.
This is huge.
Okay? And this just happened.
Yes.
This young lady gets an infusion of a medication to help also keep her Crohn's at bay. 2 weeks ago, this medication that she's been getting for,
Almost a year and a half.
okay? Tell everyone what happened, please.
I am insured, so you always take your insurance to the hospital. So every 8 weeks I turn in my card and I give them my insurance to cover this medication that my life depends on. I have to take it to be healthy. 2 weeks ago I get a bill in the mail for $13,000.
Yeah.
This medication costs $20,000 every 8 weeks. And my solution was to take this every 8 weeks for the rest of my life. Do the math. 13 times about 6 to 7 times a year. And they sent me that bill. So why does insurance not cover this?
It's not like a boob job.
No.
You know, like I get it. You don't want to. You don't
Yeah.
want to cover that. Okay,
Right.
I'm with you.
Yeah, my life
this
depends on
is
it.
Right.
why-
So a young lady in her early 20s is going to go, oh, honestly, $300,000 in debt over the next 2 years because this life-saving medicine is not fully covered. So again, and you know what's more upsetting? Why I'm so mad? Because I know this medication is only a couple $100
Yes.
if that.
I've actually looked
Okay.
into that. You're not lying.
I'm sick and tired of hearing my insurance doesn't cover it. Guys, I'm done. Call our
Yes.
office. Get these tests done.
412, right?
You got it.
So 227-9255, 412-227-9255 on the web, integrativemedical360.com. 47 states they operate out of.
You got it.
7, okay? And one of them where you don't is where none of us should be anyway, because we're not allowed to be out vaccinated. Anyway.
Oh, get out of here.
Right.
Hey, listen, I'm so happy. Is this not an awesome story?
I've heard wonderful
Or
things about you from the people that...
So, and I wanted
Yes.
everyone to
Life-changing.
hear it from her. Because I can
Life-changing.
say it till I'm blue in my face, but hearing her story, and then what happened a couple weeks ago with this whole insurance dilemma,
This
it's
is where we are.
amazing. This is what we do here.
Yes.
Get in here, get into this office, get this stuff done, and let us help you.
Yes.
I don't know what else to say. We appreciate you guys coming back week after week. I know you find this valuable because nobody else is talking the way Dr. Darren Dubiak is or offering what he offers. Please take care of yourself, okay? Until next time, peace, everybody.
Bye, guys.